All right, so cases like this, you want to go nice and slow, because if you take a look at the creases here, you're going to see that his hand was wrapped up like this, and he's lost a lot of that arch. His MPs are in extension versus in flexion. You see the S-scar?
Yes.
All the S-scar. The stitches look really good, but that blackness just needs to get cleaned off and see what can come off.
Yeah.
So we're just cleaning with normal
Por ahí fue la
saline,
cortada.
Por ahí. Sí.
and we can clean the rest of the hand, and we're gonna need to start moving un poco.
Hay que empezar a
Poco.
mover.
No, no me duele, pero me pone nervioso.
Yeah, so we're just gonna go nice and slow.
Porque no sé si
When you're
todo
working
está
with
bien.
someone who is post-surgical, you definitely always want to make sure you're looking up, making sure they don't pass out, they don't turn gray, they
Quiere
don't start
agüita,
sweating.
déjeme saber.
Aquí.
No se me vaya a desmayar. Miguelito, me dice algo, por favor.